Let's talk about Graves' disease and its treatment. No, not that one. Come on, let's find out. In this video, we will look at the causes, signs, symptoms, and nursing support and interventions for Graves' disease, otherwise known as Bastow's disease. To understand this disease, let's discuss its relationship with our thyroid function. The thyroid gland is located over your larynx, or your voice box, and wraps around your trachea, or your windpipe. It resembles a butterfly and produces hormones that regulate body temperature, growth, and development. It plays a severe role in the control of your heart, muscle, activity, hunger, stomach functions, brain development, and even your bone maintenance. Your hypothalamus secretes TRH. Then the anterior pituitary gland picks it up and releases what's known as TSH, or thyroid-stimulating hormone. Finally, this causes the thyroid gland to secrete thyroid hormones T3 and T4. T3 and T4 help us burn calories. It determines how quickly we digest food and the rate at which new cells replace even our dead cells. It stimulates the sympathetic nervous system, which is responsible for our alertness, reactions, or reflexes, increase in our body temperature, heart rate, blood pressure, our fine motor skill, and even helps our brain develop, especially in children. It's crucial to pay attention to this definition, as it will be useful throughout our entire discussion of the video. Graves' disease is a cause of hypothyroidism, or overproduction of your thyroid hormones. Due to an autoimmune disease, the thyroid gland becomes overreactive and increasing the amount of T3 and T4 in our body. With autoimmune diseases, the body releases an excessive amount of hormone called TSI, or thyroid-stimulating immunoglobulin. Your body sees TSI as TSH because your body cannot distinguish the difference. Therefore, it produces high levels of T4. Remember what T3 and T4 do to your body? With Graves' disease, amplify that. To easily memorize and prepare for your exam, think of zombies when it comes to Graves' disease. Zombies never stop eating, but never gain weight. T3 and T4 help your calories burn, which you burn faster in Graves' disease and cause weight loss. Zombies don't sleep and don't stop moving. The explanation for this is because T3 and T4 are responsible for reflexes, activity, and rest. Remember, this includes our bowels and urine as well. T3 and T4 are responsible for the speed at which we digest food, and because of that, not all of the nutrients are properly digested and absorbed, which is added for the reason of weight loss. Some zombies, especially in sci-fi, might have big lumps on their bodies, just like the neck, or weird discolorations on other parts of their bodies. The explanation for this one is that a goiter is a result of overstimulation of the thyroid gland, usually present on the front of the neck, or you could have a discoloration or pretibial myxedema, which is also a sign of Graves' disease, which is a red bump with orange peels on the skin, usually of the lower leg, but can develop on other parts of the body. Zombies are afraid of the heat, or of the sun. I mean, they like being cool underground, right? T3 and T4 increase your temperature, which causes heat intolerance, and an increased body temp, which is a very common sign in Graves. Zombies' eyes are fixed and can bulge out, as they're always looking for their next meal to eat. This is known as exothalamus. Some patients have protruding eyeballs. This is due to inflammation and swelling of the tissue behind the eyeball, and this is a late sign of Graves' disease. Zombies are scary, and they can cause an increase in our blood pressure and heart rate just thinking about these horrid things. Excessive T3 and T4 in your blood will increase your heart rate and blood pressure, just how they make everything faster. So, as the attending nurse, you would want to monitor their heart rate because they can become tacky. You should also monitor their blood pressure because it will likely be high. Monitor their weight as they burn calories quickly. Make sure they eat a high-calorie diet and avoid iodine-rich food like seafood and dairy products, as it can cause an allergic effect to Graves' disease. Watch the temperature and possible cooling measures may be needed. Keep the environment cool and calm due to heat intolerance. And no salicylates. These increase thyroid hormone, and also avoid aspirin. Medications. Most doctors will prescribe methimazole or tapazole, a common antithyroid hormone. It's a thyroid suppressant that have fewer side effects than other medications, but they are not safe during the first trimester of pregnancy, so keep that in mind. Another antithyroid hormone, propyltherasol, or PTU, is safe in the first trimester, but requires monitoring of the liver enzymes due to the risk of liver failure. Side effects include agranulocytosis and thrombocytopenia, which is low platelet count. Explain to your patient that these medications may take some time to work and that they should continue taking them even if they feel like it is not working, because these medications will be lifelong type of therapy. Because if hyperthyroidism is left untreated, it can lead to a thyroid storm. A condition includes fast heart rate, chest pain, fever, and so on, and could be life-threatening. Watch out for signs of toxicity. When we try to reduce thyroid hormone, this can sometimes lead to hypothyroidism, which include bradycardia, cold intolerance, and low blood pressure. The treatment options for thyroid include radioactive iodine, a thyroidectomy, and beta blockers to control the heart rate and blood pressure. Radioactive iodine is administered in capsule form. It targets and gradually destroys the thyroid gland, but it's not recommended for pregnant or nursing women due to radioactive material. Possible mild side effects can include, but not limited to, taste changes, nausea, and swollen salivary gland. A thyroidectomy is a surgical procedure to remove the thyroid gland. Watch out for thyroid storm, a potentially life-threatening condition due to excess T3 and T4 when thyroid is removed. With this, you should monitor respiratory status, and for signs and symptoms of bleeding, you should also monitor the calcium level. Thyroid removal can damage the parathyroid gland that is in the thyroid gland, and this can cause hypocalcemia. These symptoms include muscle cramps, dry skin, cognitive problems, abnormal heart rhythm, tingling and numbness, especially around the mouth and hand. Beta blockers. Beta blockers like, for example, Inderal or metoprolol, help manage symptoms such as tachycardia and high blood pressure, and even heat intolerance due to decreases in diaphoresis of the skin. Proper monitoring and patient education are crucial for effective management of hyperthyroidism. Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.